Right, in this video I would like to talk about articulation. Now, if you're going to make really good high quality dentures for your patients, then you need to think about what you can do to mitigate any mistakes going wrong. And it's more about, if something goes wrong, how do you figure out what's going wrong and how do you correct it? So quite often when I'm doing a bite registration, I'll mess it up. It happens. Taking bite registrations is really difficult, and anybody who says it's easy is either lying or confused, because it's not easy, it's difficult. There's so many things that can make it go wrong, and quite often you get the odd crazy patient and you ask them to open their mouth and they open their eyes. You get patients that you ask them to just relax and close your mouth, just relax, and they don't and they start going in at you. Those challenging cases, you feel like you can never get it right. Or you might think that you've got it right and you haven't, and in those sort of situations quite often I'll just go with it and I'll just see what comes back from the lab. It might come back from the lab, you put it in and it's out by a mile. The patient's just biting on one side and there's a big gap the other side, or they can't close their mouth because the posterior region's open too much. So what I do is I make sure that I've got an articulator which is exactly the same as what the laboratory's using. Now in this case I bought my technician a couple of these Artics, exactly the same as what I use here in the clinic, and that way whenever she sets up her teeth and she sends it to me, I can just take the models with the teeth that have been articulated, pop it on, and it will be exactly the same as what she's got her side. Straight away I can rule out whether they've articulated it wrong in the laboratory, or if they've accidentally opened the bite, or it's just about a process of elimination when it comes to those incorrect bites. So say usually I've missed something, I've got it wrong, maybe the bite blocks moved in the mouth, maybe the wax was a little bit too soft, or maybe the patient just clenched on it too much, or maybe not enough. Whatever it is that's happened, if I've got an Artic I can rule out whether it's the laboratory that's got the bite wrong, what I've sent them, or it's something that they've done. That's one thing, that's one reason why I have an Artic. The other reason is because they may have the bite perfectly right, but the teeth might not be in the best position. So with the Stratos articulators, they are adjustable, which means you can slide them into protrusive, so you can check the balance of the bite. So this one, for example, when I'm trying to do it here to the left, it's just catching on the cusps. So now I can just go in, I can adjust the cusps a little bit and then try it back in the mouth and do all this while the patient's still in the chair. Now the other thing I could do is I can literally move the teeth. So it might be that they've just set one side, even though the teeth are meeting in an occlusion, but they might be on a slant like this. So I can just shift the teeth about, put them in the right position. It's a minor adjustment, but we can go straight to a fit. Rather than sending it back for a retry, I can literally do the retry while the patient's in the chair. And it doesn't take that long just to move a few teeth, because all the wax is there already. Everything's articulated. It's just a case of take a couple of teeth off, soften the wax a little bit, just reset them into that occlusion of where you want them, or the height that you want them. Or it might just be that one of the teeth in the mouth, it just looks off and you just want to reposition it, and it's a lot easier to do if it's on the Artic, because then you can see where the bite is and you can just shuffle it around a little bit and get it in a better position before you then retry it in the patient's mouth. It can save a lot of time. If you haven't got an Artic, you could end up being in that position where you're constantly sending the work back for a retry, trying to explain to the technician exactly what it is that you want when you could just do it yourself. Now, as a technician, obviously I find this part of it really easy. If you've not set up teeth before, it's not that easy. It is a difficult thing to learn. If you haven't done it before, just have a go, because practice makes perfect and all that. Be confident and have a go. The important thing is you just need the right tools to do it. So you need a wax knife. I use a standard dental technician wax knife, which has got a wooden handle. Apparently you can't use them because they don't survive in the autoclave very long. I personally don't have a problem with it. They autoclave perfectly fine for me. The wood on the handles sort of dries out a bit and warps, but other than that, they're fine. The problem with the autoclavable ones is that you can't hold them properly. There's like really horrible chunky plastic, and the actual blade on them is blunt as well. It's like, it's just awful. I can't get on with them. But then I've been using, you know, a normal technician wax knife for 35 years. So for me to now change to some cumbersome hunk of metal, is just, I just can't get on with it. But if you've never done it before and that's what you use, then I'm sure you'd get used to using them. The other thing that I use quite a lot is a Lacron as well, because I'm not building up the wax is already there, and so a Lacron with a little tiny blade on it is perfect if you're just moving 1 or 2 teeth. You simply just use an induction heater like the one we've got here, pop the instrument in for a few seconds until it starts smoking, pull the tooth off that you want to move and just soften up the wax in that area, and then push the tooth in, reposition it into the position that you want it to be. Once you've got that where you want it, that tooth, just pop it on the Arctic, check it, make sure the bite's okay, put it in the patient's mouth, check it there, make sure that the bite's okay and that the tooth is now looking like it's in a good position. If it is, you don't need to be fancy about tidying it all up and going around the gingival margins and things like that. The technician can do that. But as long as it's in the correct position where you want it, then the lab can do the rest. If I was you and you're not very confident with moving the teeth about for a try-in, just start with one where you're just moving 1 or 2 teeth and you're not making too many changes to it. You can do it without an Artic, but having that articulator, it just makes life a lot easier. And by the way, this one that I'm doing here is a really difficult case. The patient's got a crossbite and it's in class 3 and she's over closing as well. Without an articulator for this one would have just been impossible. It would have probably gone back to the lab 3 or 4 times before I got all the teeth in the right place. But because I had the Artic and I can move the teeth myself while they're still in the chair, I can check it in the mouth, check it a bit more, do a little bit more, move the teeth out, keep checking it in the patient's mouth, make sure I get it right. They can see it. When they're happy, then I can just send it back to the laboratory and just say, I've moved the teeth, put them in a new position, please tidy it up before you finish it. Honestly, having an Artic in the clinic is worth it. You could get away with a plain line articulator, which is, you know, where the models just slot on. Fine if you're doing NHS, but if you're doing private dentures that have to function properly and, you know, you want to do a really good job, then get a decent articulator. You can find out which ones your labs use and then just buy another one of those. Or you could do what I did, I just buy a few articulators, give a couple to your dental technician. They will need a couple as well. They can't just have one, because you have to keep changing the work, so you might be articulating, wait for the plaster to set on one while you're using the other one and vice versa. So they do need a couple. These ones, as I say, I can't recommend them enough. The Stratos, there's by Overclar, they do a really nice face bow that goes with it as well. I can do a video on that actually, how to use a face bow on these if that's something that people are interested in. Yeah, get an articulator, get a few tools, get your Lacron, wax knife, things like that. Get an induction heater, they're not very expensive. In fact, I'll do a little video on the induction heaters and show you a little bit more how to use those. Anyway, hope you enjoyed that, hope you got something from it, and I'll see you in the next one.